solar pumps, rain guns, planting trays, miongoni mwa vifaa vingine vya kilimo. Kwenye mji wa Nakuru tunapatikana Industrial Area nyuma ya Gido Plaza. Eldoret tunapatikana Nakuru Road baada ya daraja la Sosiani. Pia tuko Kitale, Kapsabet, Iten, Bomet, Bungoma, Nyahururu na sehemu zingine nchini. Nairobi tunapatikana eneo la Embakasi, Saku Business Park. Ili kufahamu mengi kuhusu bidhaa za Fine Touch Africa, tembelea duka la Fine Touch Africa lililo karibu nawe au utupigie simu kwa nambari 0724 615 066 au 0700 169 962. Kwenye tovuti unatupata kwenye www.finetouch.co.ke. At Fine Touch, we make it green.
Hey, Mama Bless. Yaani unachemsha maji na gas ya kuoga?
Maji gani unachemsha? Bable, si nilikwambia nyumba haina shopping. Gas imeisha. Tokens zinapiga makelele kama success card. Na hakuna kitu tu umefanya. Hivi ndio tutaendelea kuishi?
Kila mtu ananiambiana lakini mambo itakuwa tu fiti toisot. Unaweza kuona sawa hapo unitumie?
Sikia sasa. Na vile mambo yamechemka kwa hii nyumba, mimi nikutolea wapi na sina? Mimi umenichokesha kwa hii nyumba. Na shinanga tu hivyo kila siku toa. Ndio nimekutumia 100 hapo kwa simu yako ujisaidie nayo.
Asante. Yeah! You wanna dance with me? Terere. You wanna dance?
Nini?
Terere. Nimedaka mamili.
Sasa daka mamili ni nini?
Ukicheza daka mamili, unashinda 5,000 times ya pesa yako in 20 minutes. Na imagine, unacheza na as low as 20, 30, 50. Ukicheza na 2,000, utapata hadi 10 million Kenya shillings.
Nenda kwenye paybill 440440. Account Kass. Amount cheza na shilingi 20 hadi shilingi 2,000 na ushinde mamilioni. Dakamita kuwa bingwa. Beba chapa sasa na tatua tatu. Cheza na mbao tu, ushinde chapa bonus ya hadi $500,000. Isitoshe, kila unapocheza unajiongezea nafasi ya kubeba brand new tuk-tuk, pikipiki, car wash machine, posho mill machine na bidhaa zinginezo. Usitupe mbao. Nenda kwa M-Pesa, weka paybill number 150 chagua nambari zako tatu za bahati kati ya 0 na 9 ukifuatanisha na neno Kass. Kama account name, cheza na kati ya shilingi 10 hadi shilingi 1,000 na ubebe chapa au bidhaa na tatua tatu.
Over 18s only. Gaming can be addictive. Play responsibly. This message has been approved by the BCLB. The new KCB mobile loan is unbelievably flexible and incredibly affordable. You can now borrow up to 1 million Kenya shillings from as low as 1.2% as a 1-day, 7-day, 14-day, 30-day loan, or enjoy a longer-term period of up to 1 year at competitive rates. Dial *522# or apply on the KCB app today. The KCB mobile loan, unbelievably flexible, incredibly affordable. KCB, for people, for better. Terms and conditions apply. Regulated by the Central Bank of Kenya.
Let's open big doors that harbor progress in all the places that we are, at all times that we can, for as long as we can.
KCB ni yetu.
KCB ni yangu.
KCB is mine.
For people, for better.
Agatin missing chitab Kalenjin netinye kamang'unet neo ale ichamegei ak imi komii onoit tugul nekere ketesiet nebo Kass TV. Ngitang'at kenyorun logoiwekab emet kobun tetutiet nebo tililindo eng yuton bo Kass TV. Kainenyu ko Caroline Kiplagat. Kitaunen logoiwek chetinyegei ak kambaget nebo konetik chebo Kupet ole kakotonon kambaget noton konetik chebo Kupet anan katuyetabkei nebo konetik nebo Kupet. Ibwat ile kitou konetik chuton bo Kupet kangelchinetab boisiet kong'eten wikit nekosirtoi ole en betab raini kokayai tuyet kibagengeit noton bo Kupet ak kibagengeit nesire konetik noton nebo Teacher Service Commission ole koityi koshinet nebo kotelel kambaget noton. Kondochini sirindet neo nebo kibagengeit nebo Kupet Kelo Misori komwa kole koityi koshinet koboto TSC en kasuldaet nebo CBA nebo kenyitab 2021-2025 en kwenutab magutik alak en kasaratan anan en komostanyin. Komwa afisayat neo nebo kibagengeit nesire konetik boisiet nebo TSC Dr. Nancy Macharia kole koityi koshinet en kasuldaetab magutik cheterter chebo konetik ak noton anan cheboto promotions ak kora tuget nebo konyoiset nebo konetik.
In compliance with the court order which was instituted and which is coming up on 5th, that is Thursday. From the union side, we suspend the strike and ask all our teachers to go back to class pending the speedy resolutions of these matters as already agreed upon between us and the Commission.
As promised on August 21st, 2021, the Commission is today pleased to confirm that the government provided funds for the implementation of the second phase of the CBA with effect from the 1st July 2024, and all our teachers have benefited from the same together with the arrears attendance. Therefore, the government has successfully implemented all the provisions of the 2021-2025 CBA with the teacher unions. Specifically, the second phase of the CBA, which was due on 1st July 2024, was duly paid in August 2024 together with arrears. To this end, the Commission issued the implementation circular. We have a copy attached. If you want it, we can get it from our corporate communications team to all teacher unions, including Kupet, as envisaged in the CBA. Further to the full CBA 2021-2025 implementation, the Commission has addressed other issues that were raised by the Kupet as follows. 1, review of the CPG. This has begun in earnest.
The members of the National Executive Board, mandated by the National Governing Council, that we were supposed to explore all means to engage and give the teachers more resolutions on the issues that they have. So far, in this struggle, we were looking at the implementation of CBA, of the 2021-2025, with the ensuing addendum on it. That one has been confirmed to be paid. We were also concerned about the compromised medical cover, because medical facilities were sending away the teachers, including those who have terminal conditions. We have so far confirmed that even the budgetary allocation, which was reduced to 11 billion, has now been restored. Subsequently, there were issues which were related to promotion of teachers. Promotion of teachers, I think now it formed the biggest demand and our concern with the Commission. We are now confirming to our teachers and our members that the portal of that arrangement is now open, and the Teacher Service Commission is looking for funds to promote as many numbers of teachers who have stagnated in their job groups. We have also been assured that there are teachers who are acting in positions of responsibility without acting allowance or special allowance because of bottlenecks created by the Salaries and Remuneration Commission. The discussions are ongoing to ensure that all the teachers who are acting in various positions will now be given the due consideration based on the outcome which has already begun with the Salaries and Remuneration Commission. We have got
Kotomo koityi koshinet kibagengeit noton nebo konetik nebo Kuppet ak nesire konetik boisiet nebo TSC nebo ketelel kangelelchinetab boisiet nebo Kuppet ko eng tai eng betab raini kokaisuldae konetik chebo Kuppet kambagosiek en kebeberwek cheterter chebo emet. En county nebo Nandi ko kaindochi sirindet neo nebo kibagengeit nebo Kuppet Paul Rotich konetik chebo Kuppet kosuldaen kambaget ole en kambaget noton ko kaiboru nerege kotinygei ak ngalalutik chekokonu kandoindet nebo kiboitinik en emoni anan Head of Public Service Felix Kosgei kotinygei ak kambaget nebo konetik choton. Nguni kenyoru sirindenyo Cornelius Keter akoindakab logoiwek choton.
Kamwa sirindet neo nebo Kuppet mornetab Nandi County Paul Rotich kole tewernatet neo eng Head of Public Service Felix Kosgei komwa kole ngeringen konetik chemitei strike kole kamwa kole tindoi amune konetikab emoni neyamei nebo kongerilchi boisiet ak kounoto konyolu eng Head of Public Service kokonyit konetikab emoni.
It is sad, colleagues, that one senior officer here in Nandi on Saturday referred to us as watu 10% yenye wenye wanafanya nini? That was an abuse. We are here because of reasons enough which the employer have declined to fulfill. We cannot be referred to as watu wachache. We want to confirm and to tell the whole world that there are no teaching and learning in our stations.
Kamwa Rotich kole nga matile kibagengeitab Teacher Service Commission konetik chepkondok chetetat koba kibagengeit notok bo Kuppet koboru notok kole tieme kokutuny TSC Kuppet koboto kokoch kamuiset konetik chotok kit nekamwa kole makoi kimu icheket akosom sigik kowekta lagokwak koba gaa kosubkei ak nemakoi testai konetisiet akoi kasarta nekaisuldae serikali makutikwak.
The other day teachers were paid their salary, but unfortunately the malicious commissioner never deducted the union dues. And the main intention is very clear, to blackmail us. They want to starve us so that we don't proceed with our demand. We are growing more stronger and stronger. I want to advise our parents that hata sisi ni wasasi, we will not be responsible for what might happen in our stations. You see, in majority of our station, we have over-enrollment of students, and the principal alone cannot manage those students, because I'm told in all stations in Nandi, only principal are in section. The safest thing the government should do is to close all the institutions, and I know they will not. And in that note, I want to tell the parents, muende muchukue watoto wenu, else they'll destroy school property and you will be made to pay. Si ajambo aende nyumbani akae na nyinyi. They have started starving the union. Lakini I want to tell you that we are very mighty because we are not after the money.
Karite Kuppet kibagenge nebo Teacher Service Commission eng nemachob arorutiet newendi komuktochin konetik kotonon kangelelchinetab boisiet ak kowekyigei class anan return to work formula ole kamwa kole ngomami arorutionoto komakoi iwek ichek sukul ak kotesetai kangelelchinetab boisiet.
We have the strike cannot be called off just in a casual way. We must have a binding document known as return to work formula. And in that document, we want the following to be captured. We want the assurance that 46,000 teachers will be confirmed on permanent and pensionable. It must be put down on a pen and what? A paper. Otherwise, maneno ya roadside declaration hapana.
Kongete taunetab Kapsabet eng county nebo Nandi, logoiwekab emet chebo Kass, kainenyu ko Cornelius Keter.
En kasarata ko kaisuldae kora kambaget neu noton konetik chebo kibagengeit noton nebo Kupet en county nebo Uasin Gishu. Kamach konetik choton sigik komatkomut lagokwak sukul amu mamito konetindet age tugul eng sukulishekab emoni. Kinyoru nguni Isaac Ogei akoindekab logoiwek choton.
Kamwa kanetik chotok mitei eng kibagenge noton nebo Kupet kondochin Elijah Mayo ne inendet ko executive secretary kole tesetai icheket ak kambagoshek koesho magetab serikali noton nebo kusimchi icheket kowek boishet akoi kekasyi magutikwak tugul.
Niaba ya walimu wa Uasin Gishu County kwa ujumla ambao ni wanachama wetu wa chama cha Kupet, kuwaambieni wazazi wote, walimu ambao bado wangali shuleni na vitengo vyote vya serikali kwamba sisi kama walimu wa Uasin Gishu County leo tunaingia kwa wiki ya pili ya mgomo. Nataka niambie wazazi wote ambao labda watoto wao labda wako shuleni kwamba ni hatari sana kwa wakati huu ambao walimu wote wamejumuika katika streets za Eldoret kuzidi kuacha watoto wao shuleni. Hiyo jana secretary wetu General Brother Kelo Misori kupitia kwa National Governing Council mliona kwamba walipata ripoti juu ya development ya mgomo wetu na ikabainika kwamba mwajiri ambaye ni Teacher Service Commission bado hajafanya lile ambalo anatakiwa kufanya. Na mimi nataka niambie tu serikali akiwemo rais wetu wa Jamhuri ya Kenya. Mgomo huu ambao walimu wanaifanya Kenya hii inafanywa ikisaidiwa na Teacher Service Commission. Wanatusaidia tufanye mgomo kwa sababu hawafanyi lile ambalo katiba imewataka wafanye.
Mwae icheket kole nyolu eng kanetik chemite eng sukulishek kowekta lagokwak koba gaa kosubkei ak nematesetai kanetishet.
The people who are helping the teachers to go on strike, and I want to say thank you to them, is the Teacher Service Commission.
Yes. Masharia.
Na angalipo bado anaendelea kutitia moyo na kutuweka hiyo hali ambayo anataka tuwe tunaishi kwa utatanishi, tutaendelea na mgomo huu. Yes. Sisi pia ni wazazi. Yes. Ibainike sisi ni wazazi, watoto hao walimu wote hao wako nyumbani. Na tungeuliza walimu wakuu ambao wanazidi kuandikia walimu messages. Hiyo message tumia bundles uangalie ufanye kitu kingine. Usiandike message. We have asked our teachers waweke blacklist all their head teachers. Funga shule watoto waende nyumbani. Yes. Kupet power. Kwa sababu sisi kama walimu hawa we have worked for 20 years. We have worked for 15 years in the same job group. Hakuna kitu kingine kinakutisha Kenya hii.
Nerekyin icheket kibagenge nesire kanetik noton nebo TSC nemwoe kole togu ko icheket chetesetai koimi tetutik chotok chebo kanetik ole mache kosuldae magutikwak tugul eng chokchinet.
The board of management funga mashule. We are going to paralyze this issue. I don't want to lie to you. We have paralyzed already. In fact, if you have seen in papers today, they have known that we have paralyzed. And in the next week, you will not like it. You want to tell government, you will not like it. We want to tell this government who are trying to, they have started going abroad. You know, walikuwa wametisha na Gen Z. Hii walimu ni hatari, sisi ndio tulifunza Gen Z. Sisi ndio wabaya. Tukiendelea na hii kazi, mtashangaa. Sisi ndio baba yao. Sisi ndio baba yao. Na hiyo pesa sijui wanajaribu kuweka sijui AU, hiyo AU hata wataanguka nayo wakiendelea. Tutaomba maombi ya walimu si mchezo. Hata hiyo AU wataanguka. Hii maneno wanaenda walete hiyo loan China, wakuja watulipe sisi tuendelee na kazi. Hata sisi hatuna, tunapenda serikali, tunaimba wimbo wa taifa.
Akot kunotok komwoe icheket kole bune kanetik kewelutik chechang mising nenyolu eng serikali kokushikwa magutikwak amait kowekchigei somanet.
Unapata watoto wameenda kwa wazazi inakuwa ni shida. Shule ni kama Mathare. Ukienda Mathare, half of the people there ni walimu swadangani. Ni walimu kwa sababu of mental health issues. Na ni vitu ndogo ndogo yenye naletwa whereby ikiangaliwa I swear the whole of Kenya will be health. Kenya mzima itapona walimu wakiangaliwa. Walimu wakiangaliwa vizuri wakifurahi, watoto wenu watafurahi. Wakifurahi pia the parents will be happy. But so long as teachers are not happy, we shall have a big asylum. We shall have a big mental institution called Kenya.
Kongateke taonit neo nebo Eldoret nemite eng county nebo Uasin Gishu logoiwekab emet chebo Kass, kainenyu ko Isaac Ogei.
Ak nguni kibendi county nebo Kericho kororwe sirindenyo Robert Siele ole kou kambaget nebo konetik chebo katuyetabkei nebo Kupet en county noton nebo Kericho.
Kong'ololjin sirikab logoiwek kasarta nekayai kambaget nebo wikitab oeng nebo kangelelchinetab boisiet kanetik chebo kibagengeitab kanetik nebo Kenya Union of Post Primary Education Teachers Kubet en county nebo Kericho, komwa sirindetab kibagengeitab Kubet Mary Rotich kole kotil icheket en tuyet nekoyai kotestai ak kambaget.
Amut ko kokitinye tuyet nebo National Governing Council en Nairobi ako kokiyonjine Kenya mzima kole warm up wikini konye. Wikini any ko kakinam kasit komie. Okere ole kakinamen Jumatatu ngamun ko koesio TSC koep chechit. Koesio kokas kole moche ne konetichu. Tomo okere employer nemoepchin biik asikeweken kibaketestai kinetisien. Amoche amwowok kole ndandan ikere ko secondary school teachers chetaketeseta anan ko Kupet members ko primary school teachers korirtos kabisa akolenjech matomuny otestai kounon koi kityo kistopen oyu lakini emugulelwekwak kemiten pamoja.
Kaesha kanetichoton ng'alaletab Head of Public Service en emoni Felix Koskei nekomwa kole officials icheken chebo Kubet chemiten en kambaget akomache icheket kowek boisiet.
Amache amwa ale ng'alechon komwa Mheshimiwa Felix Koskei ko lembech kakokas ole kamwaita kanetik. Andanyone inendet akosungukanat koker sukulisiek. Ko kor kowekse lang'at ko kakowelel kabwatutik. Echek kastab ang'wan ko kikimi kesungukani sukulisiek. Ako amache ako report ne noton kole mami kanetik sukul. Mamiten. Ako mat kole kolipane ne phase 2. Phase 2 1,000 ne chumwoe bichu. Makimache ako 1,000 noton ko backdated August July ak August. So marabisiek ichechon.
Kosubkei ak Mary Rotich kotindoi makutik chemache keityi asikowekse icheket boisionikwak chebo atkai tugul.
Komot ko ng'alekyok ko phase 2. Ng'alekyok ko kokimache keyat another CBA ne monetary. Ng'alekyok ko kokimache ke confirmen 46,000 JSS. Ng'alekyok ko kokimache medical cover nenyon ke streamline mbo kesopchi. Ng'alekyok ko kokimache CPG keriluken into it kotokor kosop CPG asikesopchi. Makemache ketamaken. Kateb biik alak en ireu kole kibure kenyisiek 15 en job group agenge. Ako job group ikose ole mwoitoi kanetik kole kwani kandoa sibur kenyisiek 15 en job group agenge. Ako kokimache kinet TSC pole pole kou yon kinete lakwet.
Kosubkei ak treasurer nebo kibagengeit noton bo Kubet Zablon Rono kokatestai kambaget en taonitab Kericho kot kekonyit makutikwak kibagengeit nesire kanetik nebo Teachers Service Commission. Ng'alalet nekarob eun nebo ng'echeret en kibagengeit noton nebo Kubet en mornetab county nebo Kericho John Korir namwa kole ikotestai kobut ng'atutik kibagengeit noton sire kanetik.
Raini kokur kanetik tugul asikobit kebendaten en Kericho ak kebe kesungukan kong'eten kinamen town Rio Cable Plaza kebendi ketokyinigei Huduma Center ak kebe streets tugul chebo Kericho asikemwa message agenge kemwa kele kimache TSC kokas it kanetik.
Kinetech akichek TSC ng'alechutet chebo tabia mbaya. Kilenji kotini TSC okonfamen JSS 46 ako kompensaten lakini mayai kou noto. Nebo oeng kilenji ng'alekab korik rabinik chon itile ng'alekab korik house levy ko unconstitutional. Lakini kitestai kotil korik ako kiketech korik en gaa korik chekonye kityo ko chumba barak Kipsengwet.
En kasaraton kotakyigei kanetichoton alak en sukulisiek cheboto sukulitab Toror Girls Secondary en Ainamo en county noton asikomong kanetik chekamiten en sukul ko oret agenge nebo koteskei tugul en kambaget. Kong'eten county nebo Kericho logoiwekab emet chebo Kass, kainenyun ko Robert Siele.
Kakomong'ugei boisiekab Cork en county nebo Nandi akosom serikali kosuldae koyomiset nebo keliponji ichek melekwek chebo 7,000 en kila arawa asikonyoru cherset ichek nebo kotestai ak boisionikwak. Kamwa nebo kecheret en kibagengeit nebo boisiekab Cork en county nebo Nandi Wilson Chemalal kole boibochini kayomiset noton kikonu serikali ole moche kisuldae en chokchinet asikonyoru kelchin boisiekab Cork en emet. Nguni kinyoru sirindenyon Nelson Tarbei ak kondakab logoiwek choton kong'eten Nandi Hills.
Kamwa Chemalal nekang'alalchin ketesiani en koret neinegei kole yoe boisiet neo boisiekab Cork en emoni ole kinyolu kokakonyor melekwek.
Kosubkei ak chepkondok kikomwa serikali kole sirtowech kokimoche kesom ko ki boisiekab Cork chebo Nandi County kele tanyolu kosirtowech serikali chepkondok chotok sikobit ketoretegei en boisionik ak ichek chekitinye amu kingen kele serikalit nyo nebo Kenya komakomi chi noe kasi buch. Boisietab boisiekab kok kokas ngalek ground amu tinye imanit yotok, ngalekab mbarenik, ngalekab familia chekasirgei, ngalekab atebet nemie, komakimeche as keba kele kimeche chito nebo form 4. Kimeche kele eng kirwogetab kan nebo boisiekab kok kobo boisiek konyolu kikoch boisiek kityo kou yemite kou notok.
Kounoto kokoitoi ine kurset eng President William Ruto kosulda eng chokchinet kayamisanoto bo kekochi ichek melekwek.
Kou yekikemwa kelechech kikonech chepkondok chotok, kokimeche kekonech kou notok amu kekas kele kikonech chepkondok chenekit around 7,000 eng arawet agenge. Kekere kele ko kiboisiekab kok amu kikiyai kasit buch eng betusiek chechang. Kekere kele nyolu chotok koame chotok amu maui kokiyoe buch kasisiek. Kosubkei ak notok ko ndakakosirto serikali chepkondochu kokonech akot kit neiboru kole eng kemi kimi koboru kole ki biik chebo serikali kemoche kele takikonech akot kala nebo uniform asikobit keboisie ak keterchin ak biik chemi ground amu notok ko kondit agenge nekakeker kele keboisiechini serikali eng oret nebo iman.
Kaibor ine kora kaimetabgei kotinygei ak kangelchinetab boisiet netesetai kanetik eng emet ole kabinet eng kasarta nekakotoi sukulishek kowekta kipsomaninik koba gaa.
Kokasome ale kikisirtochi iman kuye mwae serikali chepkondokwak kotinye haki komwa koman akobo ngalekab kanetisiet, lakini kamoche asom kora serikali ale yekikisirtochi kikoch anan kotuiyo akoteb ngwony akong'alal nebo iman sikosikinet lagok chebo sigik amu nguno kokanyililso sigik, bendi lagok sukul ak kipkiwek ako lagok komakonyoru atkan tugul security neribot eng sukul komie. Asa sukulit ne mix ne boys ak girls ko nguno angot komanyor kanetisiet komi mwalimuinik sikorib lagok komuchi koek asenet tuwai kolipan sigik fees tatya baadaye komatokotar lakwet sukul. Ngalen onget akobo lagok chekakotebi ichegei komakararan kokasome serikali kong'ololjin ak mwalimuinik sikobit kokwachi haki nenywa nekikamwa.
Kong'etegei county nebo Nandi logoiwekab emet chebo Kass, kainenyu ko Nelson Tarbei.
Kakoboru kaimetabgei kibagengeisiek chemobo serikali en county nebo Kericho chemi en kaimetab Kericho Civil Society Networks kotinygei kaimutiet nebo rorunetab kerichek en sipitalisiek chebo county nebo Kericho eng mwaet kole nyolu keib kakwautiet nebo chokchinet keal kerichek asimatestai konyoru kaimutik biikab emet. Nguni Robert Siele koiwech logoiwek chuton en koindo kong'eten Kericho.
Kong'ololjin ketishoni kasarta nekait tuyet kibagengeisiek chemobo serikali chebo Kericho Civil Society Organizations Networks en county noton nebo Kericho asikong'alalen kotinygei ak boisionikab ketishosiekab konyoiset en county noton kobor kaimetabgei kibagengeisiek choton kondochin coordinator David Ruto akobo nemwaat kele rorunetab kerichek en sipitalisiek.
Kokinyoru report nemwoe kole mami kerichek sipitalisiek en Kericho. Iniwe sipitalit age tugul en Kericho ko mami kerichek. Kokiyom kitaketeb soiti ngandan tomo kenyoru report neo komwaat kele mwaat afisaek chemi sipitalisiek kole kokomach kouit mekoitu kerichek sipitali.
Kosubkei ak Ruto komiten mionwogik chemokyingei kerichek en chokchinet kobaten rorunetab kerichek choton ko ng'oyondit ole karirtaen kora katabanetab rabisiek chekitokyin department nebo tililindo.
Ninyoru chito nendoi ng'alekab teget chemoe asthmatic kole ko lazima kwal kerichek alak chekikuren inhaler ko chon toreti chito kodecongesten kobus chito komie. Ko ni ikas kit neunon amun mi mgonjwa ne koasibi nemi kapkatet ko kokilenjin kokeadmiten ako mioni ak kelenji lazima ial kerichek chebo over 1400 kerichonoton ak kelen makikonu en sipitali ako kikipitishan kele makikonu kerichonoton en sipitali. Korusech kwong'et kele ane rabinichu kikinde budget chebo niker budget nebo health en Kericho koibe percentage neo. Wo percentage nekikikoi health ako komosta neo kora ko kikinde komostab kial kerichek.
Kosubkei ak kibagengeisiek choton komagat ketikechikil katabanetab rabisiek asikinyigis sectors chebo kamanut.
Koboisien chito 1.5 million kochob barabaret ako kakikoi budget nebo 7 million. To kanyo koba sipitali rabinik chon akotoret biik. Amoche kinde sipitali koik priority number 1 ak beek priority number 2 ak so education. Tuguchono chetinye chi tugul amun ibore iker barabaret ko nekit tinye mokorek. Inyoru contract chebo barabara ko biik chesoben ko wafanya biashara che contract ichot. So ko ng'olyon nekokitinye non ine ak ketesetai kisibi budget nebo county kemoe keker kele kaki-implementen ak konyor biik services chombo social cheribe sobetab chitugul.
Kabit ng'alaletab kibagengeisiek choton kasarta nekayat county nebo Kericho tuiyosiekab ibetab keretab biikab emet anan public participation en komoswek cheterter chebo county noton asikokochi boroindo biikab emet kokon tuguk chemoche keyochi icheket asikitabanchi rabisiek cheyomotin. Ole kosubkei ak kibagengeisiek choton kotesetai ak tuiyosiek konete biikab emet akobo kamanutietab tuiyosiek choton. Kong'eten county nebo Kericho, logoiwekab emet chebo Kass, kainenyun ko Robert Siele.
Kiwang'chini yotoshietab Kalenjin logoiwek cho chebo emet chekaitunen nguni kong'eten studio nebo Kass TV kobun tetutiet nebo tililindo. Kainenyu ko Caroline Kiplagat ako kituisoti en kebeberta nebo oeng nebo tetutiet niton bo tililindo ole eng betutab raini ko kimite ak Daktari Sylvester Kimutai kobun sipitalit nebo Tenwek en county nebo Bomet ole kibendi keng'ololen en kebeberta neo engset anan surgery eng konyoiset koimutik cheterter chekotestai koityi sekta niton bo surgery ak mising ko lipanet anan chepkondok chemokotin en kebeberta niton nebo engset anan surgery. Ko en kebeberta nebo oeng ko kituisoti ak Daktari Sylvester Kimutai ne inen ko Consultant General Surgery, kora Chief of Surgery ak Deputy Director nebo Medical Services eng sipitalit nebo Tenwek en county nebo Bomet.
Let's open big doors that harbor progress in all the places that we are, at all times that we can, for as long as we can.
KCB ni yetu. KCB ni yangu. KCB is mine.
For people, for better.
Tetat KI edition nebo kenyini nebo labatet nebo Nairobi City Marathon eng tarikit 8 arawetab 9 kenyit nebo 2024 eng taonit nebo Nairobi. Labatani bo Nairobi City Marathon kotetat korwairwoi kobun barabaret nebo Expressway. Tesetai nguni siretab K nebo labatani eng categories cheterter. Eng category nebo 42 kilometers kesirengei 1,100 ak 500 eng 21 kilometers kesirengei 1,100 ak 200 eng labatet nebo 10 kilometers kesirengei 1,100 ak eng labatet nebo 6 kilometers kesirengei 500. Asisirchigei labatani irutechini website nebo Nairobi City Marathon nebo www.nairobicitymarathon.com. Nyon labat ak iboiboenji lelesta nebo barabaret nebo Expressway koboto barabarosiek chebo taonit nebo Nairobi eng betunoton.
Fine Touch Africa Limited inakuletea pipe za irrigation na pipe za kusambaza maji zijulikanazo kama Fine Drop HDPE pipes. Fine Touch inatengeneza pipe hizi kwa ubora wa hali ya juu na kuuza kwa bei nafuu. Fine Touch Africa pia wanahusika na pipe za drip irrigation, rain hose, sprinklers na vilevile pampu za maji. Vifaa vingine vya irrigation kutoka Fine Touch ni kama vile greenhouses, agricultural nets, dam liners, solar pumps, rain guns, planting trays miongoni mwa vifaa vingine vya kilimo. Kwenye mji wa Nakuru tunapatikana industrial area nyuma ya Gido Plaza. Eldoret tunapatikana Nakuru Road baada ya daraja la Sosiani. Pia tuko Kitale, Kapsabet, Iten, Bomet, Bungoma, Nyahururu na sehemu zingine nchini. Nairobi tunapatikana eneo la Embakasi, Saku Business Park. Ili kufahamu mengi kuhusu bidhaa za Fine Touch Africa, tembelea duka la Fine Touch Africa lililo karibu nawe au utupigie simu kwa nambari 0724 615 066 au 0700 169 962. Kwenye tovuti unatupata kwenye www.finetouch.co.ke. At Fine Touch, we make it green.
Dakar, Mamili ni virahisi. Uko na nafasi 3 ya kuwa milionea kila awa. Usipitwe, cheza daka, ushike mita yako sasa. Chagua nambari zako 4 za bahati and win up to 10 million every 20 minutes. Nenda kwenye paybill 440440. Account
Kass.
Amount, cheza na shilingi 20 hadi shilingi 2,000 na ushinde mamilioni. Daka mita, kuwa bingwa.
The new KCB mobile loan is unbelievably flexible and incredibly affordable. You can now borrow up to 1 million Kenya shillings from as low as 1.2% as a 1-day, 7-day, 14-day, 30-day loan, or enjoy a longer-term period of up to 1 year at competitive rates. Dial *522# or apply on the KCB app today. The KCB mobile loan, unbelievably flexible, incredibly affordable. KCB, for people, for better. Terms and conditions apply. Regulated by the Central Bank of Kenya.
Akisi amini kabisa.
Ako kama kawaida hii iko request akatugul nimo kinige kichongani gere screen ngunya komite na baje ba WhatsApp ani bi chama na ba Facebook ije ngichongan Kass FM.
Magat kinet pik ing barasoshek, magat kinet pik ing kanisoshek, magat kinet pik ing forums akatugul chemuch kinyor pik.
En sheria kokonu kenyit agenge. Kongeten kokakipitishan keripilen keisto NHIF kokonu kenyit agenge kot keyai transition.
Ndekibendi tu anguno akerwa ko keyai mazoezi marathon. Kebendi ngemiyo inai ke korok ile mi committee metingung biik 7. Metingung chemengen ile ngongo.
Tos kora chamdaat keveten anan makiveten kandoik Iran komuch kobois ko cabinet secretaries en dai. Kongoi kot missing wakili Kikoech Ngetich imiten taonit nebo Nakuru.
Asikorwech missing kotinygei ak samutik chotok tindoi meng'ikab Nandi eng serikalitab emoni. Nelson Tarbei neng'ong soet.
Nekinyoru sirinenyo Isaac Koge nemi kwen nebo taonitab Eldoret.
Kongoi missing Karo Kiplagat kole kemwa ko kimi eng county noton nebo Uasin Gishu ako eng target yung kakunin pichait noton neu taonitab Eldoret.
Kepinyenyi.
Emwa kora ile ii agenge eng kanetik chotok chebo Sunday schools. Aha, otinye kanetik chetya?
Tinye kanetik chechang nekit kanetik 6 ko mi departments mi akwane aneti ng'alekab brigade.
Mokochoronikchu ako lagok kiasiche ongekilgei eng labatet iyai mazoezi kiy age tugul ko iyai mazoezi at komenam akot tiembe komekese kiy kongomenam akot keldong'ung komami kiy iame.
Betutab raini tetutiet ko nebo boisionik chebo keljin.
Aru 93-95 kile kalany betab kahawa. So nikaanza sasa to nguno alde choto.
Mising chitab kalenjin amang ole chamegei eng olda tugul ole itesetai nyorune tugetab Kass TV eng saishechu.
Kikamwa biik kole kikowalak the political environment. Oye kemwa kora. The politics is not about Azimio.
Yes.
For Kenya kwanza. The politics is about this issue.
In the sense that we would have wished to have somebody who is versed with education. Issues about education, not law.
Ni sawa kabisa kichame tenwagik chi please tenwa naba Masai kiasi tu.
So Masai kora. Bas kitieni ra ko isubuhi. Amite Masai. Nyosarwon ko Masai.
Yes. Kebutiet nametab pentityo amu kele keboisie secondary kityo ngone chekei.
Kyane momoita kikwa sukul. Kyakaite chego kikoba sukul.
Siamini. Aki asante. Kongoi nyamu ngaitaje. Asante.
75 days since the last day of last season. We are ready to do it all again. Will Foden is having the season of his life. Brilliant! Just brilliant! That is quite something!
Dial *423# gets DSTV Compact for 3,700 Kenya shillings and connect to all the football you want on DSTV.
Kiangazi imedhiri sana katika area hii yetu ya Laikipia. Mara mingi sana katika Laikipia kuna wafugaji na kuna wakulima. hakuna yule ambaye amesaidika. Hata wakulima pia hawajasaidika na wafugaji pia hawajasaidika. Lakini kwa siku ya leo tunasema kwamba Lotto Foundation imetusaidia sana, kwa sababu inalisha jamii ambaye hawana nguvu ya kupata lishe mahali moja au nyingine.
Tulikuwa tunalala hoi. Ukweli kabisa, mimi siamini. Hata mtu mwingine jinsi tumeleta hapo usiku akuwa amesimia, akuwa na siku 3 hajaamua kitu. Kwa hivyo tunashukuru sana Lotto. Leo watoto wengi ameshiba.
Nashukuru Mungu kwa Lotto Foundation siku ya leo, maana wamekuja at least manyumba 100 leo na 10 itaweza kunuka kitunguu jioni ya leo. Tulikuwa na njaa, si mchezo, ilikuwa na njaa, si ya ile ya kusema iko njaa.
Ya kwanza tumekuwa na watoto ambao wameshikwa na hata watu wazima na utapiamlo, na pia tukiangalia hii ni area ambayo imejaa watu ambao wana rely na mifugo, na mifugo mingi imeweza kuisha kwa sababu ya kiangazi, na tunashukuru sana the Lotto Foundation kwa msaada wao ambao wameweza. Asanteni sana.
Every time you play Lotto, 25% goes to the Lotto Foundation, which supports our fellow Kenyans through various causes. Thank you for your help. Together, we are changing lives.
Fine Touch Africa Limited inakuletea pipes za irrigation na pipes za kusambaza maji zijulikanazo kama Fine Drop HDPE pipes. Fine Touch inatengeneza pipe hizi kwa ubora wa hali ya juu na kuuza kwa bei nafuu. Fine Touch Africa pia wanahusika na pipes za drip irrigation, rain hose, sprinklers na vilevile pampu za maji. Vifaa vingine vya irrigation kutoka Fine Touch ni kama vile greenhouses, agricultural nets, dam liners, solar pumps, rain guns, planting trays, miongoni mwa vifaa vingine vya kilimo. Kwenye mji wa Nakuru tunapatikana Industrial Area nyuma ya Gido Plaza. Eldoret tunapatikana Nakuru Road baada ya daraja la Sosiani. Pia tuko Kitale, Kapsabet, Iten, Bomet, Bungoma, Nyahururu na sehemu zingine nchini. Nairobi tunapatikana eneo la Embakasi, Saku Business Park. Ili kufahamu mengi kuhusu bidhaa za Fine Touch Africa, tembelea duka la Fine Touch Africa lililo karibu nawe au utupigie simu kwa nambari 0724 615 066 au 0700 169 962. Kwenye tovuti unatupata kwenye www.finetouch.co.ke. At Fine Touch, we make it green.
Hey, Mama Bless. Yaani unachemsha maji na gas ya kuoga?
Maji gani unachemsha? Bable, si nilikwambia nyumba haina shopping. Gas imeisha. Tokens zinapiga makelele kama success card. Na hakuna kitu yote umefanya. Hivi ndio tutaendelea kuishi?
Kila mtu ananiambiana Donald, lakini mambo itakuwa tu fiti twaisort. Unaweza kuona sawa hapo unitumie?
Sikia sasa. Na vile mambo imechemka kwa hii nyumba, mimi nikutolea wapi na sina? Mimi umenichokesha kwa hii nyumba. Na shinanga tu hivyo, kila siku toa. Ndio nimekutumia 100 hapo kwa simu yako ujisaidie nayo.
Asante. Yeah, you wanna dance with me? You wanna dance?
Nini?
Nimedaka mamili.
Sasa daka mamili ni nini?
Ukicheza daka mamili unashinda 5,000 times ya pesa yako in 20 minutes. Na imagine unacheza na as low as 20, 30, 50. Ukicheza na 2,000 utapata hadi 10 million Kenya shillings.
Nenda kwenye paybill 440440. Account
Kass.
Amount cheza na shilingi 20 hadi shilingi 2,000 na ushinde mamilioni. Dakamita kuwa bingwa.
Tetat KI edition nebo kenyini nebo labatet nebo Nairobi City Marathon eng tarikit 8 arawetab 9 kenyit nebo 2024 eng taonit nebo Nairobi. Labatani nebo Nairobi City Marathon kotetat korwairwoi kobun barabaret nebo Expressway. Tesetai nguni siretab K nebo labatani eng categories cheterter. Eng category nebo 42 kilometers kesirengei 1,100 ak 500 eng 21 kilometers kesirengei 1,100 ak 200 eng labatet nebo 10 kilometers kesirengei 1,100 ak eng labatet nebo 6 kilometers kesirengei 500. Asisirchigei labatani irutechini website nebo Nairobi City Marathon nebo www.nairobicitymarathon.com. Nyon labat ak iboiboenji lelesta nebo barabaret nebo Expressway koboto barabarosiek chebo taonit nebo Nairobi eng betunoton.
Agotin mising chitab Kalenjin atinye kamang'unet neole imi komie ak ichome kenoi tugul nekere ketesiet nebo Kass TV. Itagat mising en kebeberta nebo oeng nebo tetutiet nebo tililindo neitu kong'eten yuton bo Kass TV. Kainenyu ko Caroline Kiplagat. Kou yekomwon eng tai chitab Kalenjin kemboutab raini ko king'ololen engset anan surgery en konyoiset ak konoisewech chuton mising en koindo asikekuyen komie ko daktari Dr. Sylvester Kimutai kobun sipitalit nebo Tenwek en county nebo Bomet. Itagat mising daktari.
Asante sana.
Yes. Igat biikab Kalenjin ak imwochigei ile ing'o ak iboisie eng ano.
Kongoi nafasi nikawanyoru. En kainet ko Dr. Kimutai Rono Sylvester. I'm a surgeon by profession. Ago atononjini surgeons tugul en Tenwek. Ago also director nebo medical services. Ako anetisye chebo masters che surgery.
Okay.
Kongoi.
Itagat mising?
Kongoi.
Ay, karibu sana. Ako ngechut directly daktari, amang'u itinye naet anan experience ne en field niton ba engset anan surgery. Tos mara iguyewech eng chi labda nekakas surgery anan ko engset kuna tofauti nyingi. Mara inoisewech ako mara your specialty ko ne?
Yeah, ene mangele surgery ko ngobwat itu kolelen ketil chito but kikochanga ortinwek chemuche kinya chito en ngele surgical care. Kikochanga kibore innovation, new ways chemuche keyai tugun. Mi chebore laparoscopy, minimal access surgery. Chem me magele yache iyat chito ala itil neo. Ichenge kibundo konda kidogo asikeyai operation en orit. Nguni mi chekebore robotics kora. Kiboisien robots koopereten en chito. But tuguk alak kotom koit ine konamak en Kenya. Yes, en ane ko amuche ayai the open procedure, open surgeries, and also the minimal access surgeries en Tenwek as a surgeon. So yeah, chang tuguk chemuche keyai en operations.
So imuch i-deal with any kind of labda surgery nekakibun anan mi specialty nengung neitokchinigei?
En ane nguni aenye sana ngalekab cancer, surgical oncology en Tenwek. I'm a general surgeon by profession, but more and more ngalekab cancer kotienge mageno nemiten kama simbo South Rift, lakini sana en Kenya. Ago not Kenya only, in the world cancer is becoming a problem. So that is why we tend to do that. Yes, lakini kitrain en majority of the operations, even neurosurgery, ngalekab pediatric surgery, yeah, head and neck, but general surgery it's broad from basically from head to toe. But right now ngalekab operation for cancer sana.
Okay, that boisit neo neye ako mangu unasaidia watu wengi sana.
Yeah.
Mara kemo icheleito nondo chini surgeons che vaise en hospitalit nebo Tenwek. Mara tos ne anan to type of surgeries ne muchi koyai hospitalit nebo Tenwek.
Kongo ende witeno. Kigo below Kenya, gaite legimi. In the past kibendi victimin, bendi India, bendi ano. Lakini kiko changa these options commit in Kenya. Now in Tenwek ketindai majority of the specialized surgery jawaje gemokike. Ni ngalalen cheosen agoi lagok. So ngalekab konyek, ophthalmology, eye care, hair operation. Tenwek is one of the few centers chemuche koyai corneal transplants, cornea, key transplant in cornea. Ngalekab kelek, dental surgery. Ngalek, jabo ngele general surgery, like myself, lakini mi got specialized aspect of general surgery.
Okay.
One of the few centers in Kenya, chemuche koyai open heart surgery. And then other operations jigia ko ENT, ingalolen, ngalekab neurosurgery, for people chetindo brain tumors, and go, whatever it is in the brain, maybe trauma. Akan orthopedics, chebo, kawek, and nelik, all those, all of these are available in Tenwek. So we are privileged, and yani tukemujege damon kitindai ungano ak partnerships chetoreti keite legemi.
Ako kemwa ile kikobunu olelo emetab Kenya eng tetutik chuto bo engset anan surgery in terms of amangu boisietab muswoknotetab kasari nikikotes missing ole oyoitoi surgeries eng ole oboisie. Kobaten yeingalanen akot chekemwa ile che sipitalit nebo Tenwek omuchi oyai ko lipanet mara tebenge chito kole amu kose kole surgeries choe koechen missing kobaten ngolonwech kityo in terms of lipanet nebo the entire surgeries tos une ako mara sipitalit kityo nebo Tenwek kobaten eng emetab Kenya amu kaimwa ile kikotestai emetab Kenya mako chang biik chebendi sang nebo emet kochenge tetutik choton chebo surgeries.
Yeah, ngalekab rabishek ala lipanetab bilishek. Ma nyumnyum en emet agetugul in the world. So healthcare and even yenyo ngalekab operations, they are very expensive. Kali. So magele tabu ninyonet echegen as Kenya ala tabu ninyonet as Tenwek. So it's a problem now as it because of where we are located ana elegimiten ke kisaveni biche sana ko mamuchige iniba iger even part of our mission ke today aspect ni compassionate care. So pike chang ot mamuchige engalekab kolipan kosa ke toreti. But in bagele kilipandono bilisheju ko sana maybe almost 80% en biik chebwone anan biik chekikere koboisien NHIF. Magerge ak sipitalisiek alak chemi Nairobi alan Eldage en biik chechang chemuche komuchege tindo insurances alak. En olin koyoche kechi chito arambe anan ko sait age imuche kwalda koret kwalda tuguk chekachanga chekatotoretenge. But kimwani kongo kou kineun NHIF ko kikotoretech kikotoret wagonjwa because makitindoi biik chechang chetindo insurance anan chekele tindo rabinik. So NHIF nikikotoretech akany partners through this compassionate or needy fund, kikure needy fund. Toreten biik chemamuchege. So noton nikikotoretech ketesta en operations chi kimamuchi chi konyor ndakilelen konyo Nairobi ala kwa Eldaga. Ne ndakimokie ko kongem sobetab chi. Kimwoe kongocho.
Mara iwech kityo daktari some sort of a breakdown ne niyoe surgery koiku these expensive ago in this array of surgeries ngobo metit ngobo the heart ipanganwech kora tos like in terms of tos ne neyoe kole kaba barak mara chepkondok chekimokchinige.
Yeah, sana igere iniwe sipitalishek alak ko tam kekure surgeon's fee ko sait age ko yenyon ngunon inyon igere leu Nairobi anan imande timin. En echek kekere kele ne nekakiboisien kong'eten kerichek kotokomi kit nekeyoche kinde borto ko ngunon yongiyote muguleldo open heart surgery ko sometimes kotiengei en valves chemi muguleldo keyoche kinem ak kinde age. So those devices anan tuguchu kinde chito sikobois muguleldo ko kali lakini noton neibe ko barakiat the cost. But en echek makiliponi daktarishek kele kaoperaten ak this amount. So that is why partly ko matindo mawendi barakiat bilit. Ako kit age ko tena ko non-profit. Ma biashara. So bokialde ungit kwa ndamun kakimwa kityo coveren the cost nekakobo kakibunen tuguchoto. So not amune nekere le en operations changia ko get a fraction, maybe even less than half to even a third of the cost ndakayenyone kewendi sipitali age bo private.
So ye comparean ak other hospitals mara che kere ye daktari this kind of an operation komi chekitetat kelipan labda daktari or nekaye the surgery.
Exactly. So makitindoi makikoini daktari kele kaye operation ini inyoru this 20% ala this percent mami kit neu non. So ngunon ke operation keri ngunon gele orthopedic surgery, gele koil chito anan tindo arthritis nebo hip joint anan nebo gutundo keyoche ki replace what's called total hip arthroplasty, anan ko total knee yenda chuma ini. So en yun kialde ngito chuma yote ake coveren maybe anesthesia ak recovery period kityo makiteshin yake barakiat. So nobody get operation chukucho maybe around 450,000 ngele orthopedic surgery. Iwe neurosurgery kora ko it's a range from a point nekiyae kibare debridement maybe around 40,000. It's as cheap as even 20 and 10 an operation ako around 450. Me in general surgery ngunon general surgery but there could be me specialized operations engwenutyo mucho koit tot a million. Chukaba muguleldo ngeba kele kakiyat muguleldo. So iba igero en Kenya there are few centers chemucho koyai but en 10 kien up to 1.6 million kityo. Elsewhere en Kenya neken kumuche keyai beyond 5 million. So noto kaborunet nebor makiyae biashara ngetoretishe ndamun chang biik chemokyingei. Ngunon over 1,000 people chekonye keyochi operation keyat muguleldo. Kimuche keyai last year alone 2023 ko kikakiyai more than half chen total and open heart surgeries in Kenya. You had around 270 of which and the total was around 500. So it's more than 50%. Kia more than 50% of open heart surgeries chetesetai in Kenya. So kikotorto ichobo ak biik alak che chekikobwa as partners as donors so konyor kokoi biik a chance konyor kit nekama otherwise kama mucho konyor.
Yemwa ile 50% of surgeries chebo heart chemuch osuldaen ingerengung ko in terms of numbers tos une issues chebo the heart eng emetab Kenya ako kora these surgeries che oyoe their successes.
So I think amucha wal kouni igere kouni ka arorun ko biik chemi list nyanje awaiting for an operation ngele an open heart na boisien ndamun we have a new center called cardiothoracic center which is going to be tindo 176 bed capacity. Kounguni komuche keyai 300 operations in a year. This hospital the new cardiothoracic center kokonech keyai 300 en kenyit. So kot kimuche keyai en Kenya around 500 ko keyai nguni around almost 300. Igere ile kakiit ketoret. Kom chemi listit nguni chekingen ko more than 1,000. So kibwote kele of course the biggest challenge ko ngalekab rabinik healthcare financing ko kine mai challenge ui so part of it mujot kigas kibore marathon and 10 it's the idea ko gileng ki ICB ke create an awareness kele ne me to ke bare ngone mokinge this operation engenya sana kine cause ni rheumatic heart disease
okay
it's a mark of the living or standard of living kidogo where it is crowded the poor living conditions so it's like it's a bacteria it's like a sore throat and then over time ko mujoko destroy some valves and in mugulelda so we don't know exactly we actually kiteseta ngalek screening around our region schools sana because school go bor it's a window to the society it's a window you get in another star so tu galak chigia go screening cho sigene gele ngona mokinge ndamun desi biname mapema ko gimuche ginya moite ge mokinge operation ni gao
ne go mechagota ateben inamu yegere ile yotinye cases cheu chogo mara mi gino yoe as a hospital in terms of kenoise chibik ap koroke tetutik chogerele komuch ochuchuch these numbers ke ngalan in screening mara mi ortinwek alak cho boisien chogerole chi mara ngotko tinye kaimutiet nebo muguleldo ko maiti labda kasarta ne mokchinige surgery
so mawon ngalega muguleldo ne ngala ngalega lubaniat cancer it's maniga kana men olen achama operation for cancer ndamun the burden is big so ibari iger bikyo kotienge tuki kachanga maybe eni ko mirabini eni ko mami naet saita got ko mirabini la ni mami naet so gela awareness ko kia itono ki noisi itono peak konai gole ngobao matkokany ta yongose kingwana na yongere ka ko etuyan yoche en sabetab chito ko yemege ko like wellness check ndamun imuche ko mena by the time ki studies chechang by the time genyoru gele tindo the cancer saita wo na acta mi stage 3 stage 4 so samenyon ne jitugul in every family tamesigo ko bwate chi gole yochawa sige chekenon periodically ko tienge kenyit meganye sta ko nget ko inyoru prostate cancer no inam mapema that way muje genyo stage nemi and earlier compared to later
ngele mi gitage daktari moy bi gole ngomaga se ngwan amune sawa chigilge amune sawa just maybe you can demystify that amuno to go kaimutiet neo amung tegewe labda iwe chigilge ko mara gisup ketoretin
oten biblia gile anxiety and fear como it's not born of God yaje kengete east nyogor natet anan east kaiwet ndamun majority of guns of cancer genyorus magele we still treat tindo we still have operation go tindo its own purpose tage operating mije bare chemotherapy sindio mije ke bare radiotherapy aganya lakche go bwo na nguni there are new models mije hormones there are many other treatment ago subchita go koge survival is a longer ago nyor the good quality of life so kete swali neta o i hospitali jito matigan yoni gose ngwan ka igerge so mi Kenya guidance ki magele onde nguni sko changa internet smartphones kele ni bigo na kole engenyit ilakwa ichine tengarngar kayo sit kone test che muche inyo o changa hospital mateno kinegen all the other hospitals iwendi pitunoti mi Kenya so magileni nyon all the way narabi nyon ten acha kimache gele message ni obachi tugul damun mage matkebwa hospitali anga igerile
kagogoromit
sigorongole ni da kibagetil onge no to go siptage acha katogele gini wendi ko yango siptage
Okay. Daktari, ng'ololwech kotinga kaimutik cheterter chemito eng field nito nebo surgery en emetab Kenya ako tos ne noyoe oker kole despite otinye kaimutik chu kotomuch otesentai boisionik che amu chang man biik chebwone sipitalishek komakchinigei kanyoiset nebo tuguk cheterter.
Challenges chechang ko kakemwa akobo the high cost, rabishek chechang chekimokyingei kotiengei tuguk chekiboisien, kotiengei sait age kotikemoche iteshi, surgeons kou kile imoche iteshi. So the high cost, even worldwide, kingen healthcare ko expensive. Now, iteshi ile surgery ko it's more expensive. So the high cost is a big challenge. That is why chame chitugul kokain kole igundano yeking'alale ng'alekab social health insurance fund yekitransition tomine kibwote kele itakotoret chitugul kou ele nyolundo simakomondoi biik anan simakokonye koit koik late stage. So that is a high cost. And then the other bit ko shortage of specialized people. When you say specialized people, komagele surgeons cheuechek. Ing'olole nurses, ing'olole biomedical engineers, ing'olole yani chitugul chemuche koboisien at this space asikotoretkei.
So mi rorunet. Mito rorunet nebo labda specialist cheu choto?
Yes, miten. So nikamwona ole kiko improve in Kenya. Mako 10 plus years ago. So mi bichuto, igere ngunon kekuren ng'alekab tenwek, ele kimi nguni ko mau 10 years ago. There are some improvements. There are more people just specialized chebwone. So but ibwate sile we are not at a point nelenen kiyomotin kitakiloen. But noton amune the other thing ko chame these specialized people over towns, which is a bit hard. Magele chame sait age ndamu mami even facilities, the infrastructure neyo kobois bichoto en ele miten in the counties, in the rural areas. So ndami ele kiipto bichu koba rural areas ko toretokse.
Kisipto ngeten taonisiek koba kokwotinwek.
Kokotok ele yoche equipen those facilities. Kimia report nekimong'u last year from the Ministry of Health kokiboru kole kitindoi ne sipitalishek chechoket. Kokiboru ng'o netindo ambulance, tindo oxygen, muche kotoret chito nerumo soiti, tindo ICU. So biik chechang yoche konaisiken ndamu it was kikakibor kit neu Kenya out of all the facilities in Kenya. So takomine yoche kitakikimit komosoto.
Okay. Ago in terms of affordability nebo labda surgeries eng sipitalit nebo tenwek ko tos biik chekwoni sipitalit noton koba kochengjigei kanyoiset kemwa man the cost anan mi barak the cost kobaten monechondoi ano ogochi kanyoiset nemakchinigei ngandan mara matinye chepkondok anan chepkondok chetinye ko ng'ering.
So kou likanamde ko NHIF ko kikotoret biik chechang, but ndewendi around ko ma biik tugul chetindoi NHIF anan netindoi SHIF nguni. So netai nekonyor chitugul insurance, whatever form of insurance. But now SHIF it's a compulsory one. And that is a basic, and it's very good when everyone is enrolled. So ndanyoru chitu an insurance, kerges nemuchige ala mamuchige ko cover ni law. Especially in tenwek around 80% and in biik chekinyoru koboisie noto. Alak ko chon alak ko kolipani cash. So the other bit komanikalen our donors kitindai some of the missionaries ago even within country like corporate organizations chetoretech. So ngunon kindai this kiti nibare needy fund, compassionate fund where whenever ndakonyone chito ngunon matindo chepkondok anan mayame kinemunen yoto siketoret akonyor kit nemokyingei. So kimoe keker kele kanyor chitugul even outside the country ndamu kinyoru biik even biik cheyobu chenge kanyoiset cheyobu timin all these countries and outside Kenya. So even but kimoche for Kenyans konyor equitable healthcare yani konyor chi tugul kotienge magilelen noni kotindo rabinik noni ko matindo kitoreti chi tugul kwagenge.
Nekamache atebin namu igere ile okwe omi olimboka county nebo Bomet sipitalit neo ako toche biik kobun counties cheterter chelekite cheloen kobun emotunwekab sang. Ite kasarta neo oiku overwhelmed ako omanagendo ano kora amu kemwa ile lazima kekochi chi tugul kanyoiset nekaitu sipitali.
Magele rahisi kine kiyoe nguni ko we calling building capacity ko kitrainen biik kalen anet akane surgeons chemoe koik surgeon postgraduate training in surgery. Tena for example kotindo 5 programs chenete koik biik koik consultants. These are people chekiyan koyai degree in medicine and surgery and now they would wish to be a consultant, a specialist in somewhere. So we have like 5 programs. Kotindo a program of general surgeons, a program of orthopedic surgeons, a program of neurosurgeons, a program of cardiothoracic surgeons, ag nebo family physicians, family medicine. So kita ngene muje kinam ko kinet biik asikolian sikonyo kotesta akonet biik alak akotoret biik alak chechang. So kibwote kele noto kwagenge en kinemuche koyai chitugul sikomuch nibuch ko kimuche memuche itoret chitugul lakini chitugul komuche kotoret chi.
Okay. Aya. Amache keib kamunget kitegen kidogo daktari eng yuton bo kiteset nebo Kass TV tetet nebo tililindo yekiwege agere chang kabisa tuguk che yeimwawech ko eng kiteset nebo Kass FM ak Kass TV kile ne kimnotet naet. So yeinai yetinye naet kotoretin en oleo. Okay, chitab Kalenjin kimite ak daktari Dr. Kimutai Sylvester kobun sipitalit noton nebo Tenwek. Inendet ko mito department noton nebo surgery eng sipitalit noton nebo Tenwek. Inoisewi tuguk che terter kotinygei ak kebeberta niton nebo engset yeicham surgery. Ako nguni amache keib kamunget kitegen matinakte amu yekiweke ketesetai anan kitesentai ngalalet niton tinyegei ak engset anan surgery en konyoiset.
The new KCB mobile loan is unbelievably flexible and incredibly affordable. You can now borrow up to 1 million Kenya shillings from as low as 1.2% as a 1-day, 7-day, 14-day, 30-day loan, or enjoy a longer term period of up to 1 year at competitive rates. Dial *522# or apply on the KCB app today. The KCB mobile loan, unbelievably flexible, incredibly affordable. KCB, for people, for better. Terms and conditions apply. Regulated by the Central Bank of Kenya.
Tetat KI edition nebo kenyini nebo labatet nebo Nairobi City Marathon eng tarikit 8 arawetab 9 kenyit nebo 2024 eng taonit nebo Nairobi. Labatani nebo Nairobi City Marathon kotetat korwairwoi kobun barabaret nebo Expressway. Tesetai nguni siretab K nebo labatani eng categories cheterter. Eng category nebo 42 kilometers kesirengei 1,100 ak 500 eng 21 kilometers kesirengei 1,100 ak 200 eng labatet nebo 10 kilometers kesirengei 1,100 ak eng labatet nebo 6 kilometers kesirengei 500. Asisirchigei labatani irutechini website nebo Nairobi City Marathon nebo www.nairobicitymarathon.com. Nyon labat ak iboiboenji lelesta nebo barabaret nebo Expressway koboto barabarosiek chebo taonit nebo Nairobi eng betunoton.
Itagat chitab Kalenjin ngetestai ak tetutienyo nebo tililindo eng yuton bo Kass TV kimite ak Daktari Dr. Kimutai Sylvester kobun sipitalit nebo Tenwek. Daktari, kakeng'alanen ng'alalet neo nekakenyoru eng kebeberta netai ko koimutiet neo eng field nito nebo surgery anan engset ko rorunet noton nebo chepkondok anan chemayeme ako man sipitalit noton nebo Tenwek kiotiemen kasarta nekoyoker kole ko accommodaten chitugul nenyone konyo kochengchinigei kanyoiset eng sipitalit nebo Tenwek. Kaing'alanen otinye donors ak mara programs alak cheokere ile komuch kotoretok biik chekwoni kocheng'e kanyoiset kobaten oret age ne labda ocheng'e chepkondok chuton ko tos ortinwek aichon kora mara mi sipitalishek alak chemuch kokere kole tos kiyai ne sapkoro kenyoru akot chepkondok asikeker kele kakitoret biik chechang chekwoni sipitali kobo kochengchinigei kanyoiset. So koi sipitalitab Tenwek tos mara mi ortinwek alak cheokere ole oboisien chetoretok okere ole konyoru chepkondok.
Kongoi en tebutyono. Ko inamde kokimng'olole ng'alekab healthcare financing. Ui kidogo ako ngunon en Tenwek Hospital ko AGC Tenwek Hospital ko it's a non-profit organization. So and mbagele non-profit ko makilenen kitindoi biashara anan nekiyae sikomuche kokone rabinik at this point. Kawaida en ng'alekab ngele Mission Hospital most of the time ko magele katindo rabinik icheket tienge collaboration. So en ng'alekab healthcare komoe collaboration no, hospital to hospital, sipitali akoi sipitali, and then government. Ng'alole government ko county, national, yache kotuyogei bichu tugul asiko keng'alalen akele kitoreto ano biik. Nibuchi as a mission hospital komomi or age nemuche kenyorun chepkondok asikele kakitoret biik. So not amune king'alole ng'alekab marathon. It's the first time keyaen netai keyae en Tenwek, tom keyae. Kibwote kele sikiyae every year. Why? Kimoche ke rabinik kakinyoru ke channelen to this compassionate or needy fund.
Okay.
So ko ngunon from January to now ko koketoret biik between 19 million ak 23 or 24 million. Biik chekimamuche kolipanchike. Where did you get that from? Ko kikinyoru en just well wishers, some corporates lele na motoret chito agenge. Even an individual. Ngunon imaile you volunteer. There are so many ways. Saida kosase chi siling bokol lang mut elibut makisase neteno ndamun mengen bako kochanga biik chikako ko toreti leo ako kit nekichamen ko makele kiome we are committed keikun transparent en tuguk chekiyae especially as a hospital kitinda like a social work department. So kit nemuche koyai bichu social work ko chikili kole iyobu and tos itindoi chepkondok, tos itindoi biik chetoretin, iker kole mami iune en ng'alekab chepkondok. Yon ikere ile matindoi ketoreti. As I said, ko ketoret biik chekachang'a. 23 million ng'eten January akoi nguni ko mo kidogo. Ibo ikero kotomami biik chetoretech anan ko feeden into this compassionate or needy fund komakoui. Ndamun tegemeo nenyon sikemuch kotesta. Nibuch magiu private hospital nemuche koyai biashara. Noton amune the cost and nebo healthcare intern ko mi ng'weny. An operation nikoyoche koik 8 million in less than 2 million. That is why. Ndamun kiome keib tuguk koik at the cost. Just koyam kele kakiliponchi kit nekakialen koyamen kounondo.
Kemwa marathon mara iororwech mara en koindo tos pou otokchini labda oyum chepkondok chetiana ko mara chi nemeche ko participaten ko yoe ne?
So marathon we are doing it not in isolation. It's through also Athletics Kenya. choto kobendi le yoto makele po komondoe. So on 7th September komiten that marathon and Bomet kirue o nega kikoen the prize agine. So njia moja negimuche kenyorun rabinik. Target nenyon nekikimokte 100 million because that is around in every year kigere kele around 150 million chekemokyinige for the whole sikotesta these operations. Nibuchi kumamuche but yani from 1937 kinge founded in Tenok Hospital kokimuch kotonon ndamun en neema. It has only been the grace. Nibuchi ne kawaida ngebaketebelo how do you survive? Oliponda na rabishek chebo biik che kasishek ako mosiche profit. Why? Kinyoru toretet neu nondo. Ako makele sikeyai kit nekilelen kilotuge. Kiyai kit nekilelen kakitoret emenyo.
Okay. Awekta let kidogo konyo nebo KMPDU en kerengung une ye compare ako mara tokchinet nebo sector noto nebo tililindo anan konyoiset en emetab Kenya kebendi tai une?
So tebude notebenge ko kilya sige devolven kikidevolven sigele sikoityi chi tugul konyoiset nenyolunot. Kawaida kingotom ke devolven ko kimatom koik developed. Imangalolen all the levels from level 1, 2, 3 all the levels of healthcare ko kikimoe sikoba koba rabinik legemin anan all the lower levels asikotoretok biik. Alaki ko kikonam ine kounon akotestai komie. Some counties have really done well. So I think they deserve to be to be told thank you because not ndamun toreti biik. Kine challenging and evolution of healthcare go ngalekab human resource, how do you manage doctors or all these healthcare personnel. That to manage within the county sometimes is a bit of a struggle. And so that is why sometimes people feel like healthcare from the national level. The other bit ko kia itono ngalekab kiriptono ngalekab the budget ngoi health ako boys komie ko chitugul kongen eleu sipitali nekit ka testoi tono kiboisie rabinik komie mi kerichek mi this medical equipment ingele medical equipment ko very expensive from laparoscopy chemuche keyat tikole ngibundo konda kidogo akeun operation so those equipment ko kali usually ko yonga pooling resources to the level of national so when you're a better bargaining power outside the country with this equipment. So there's it's a balance tos kitebenji tugul nekase nguno ngele une sipitali shek chenekit en okwe kiboisie rabinik komie kitoreti biik kyok alak ingoleke.
Okay. Chomo atebenin kotinga ak shift daktari amuka ngalanen kakas ingolonen eng tai. Transition ni kongeten NHIF agoi shift kikotestai koibu mami kakuyet komie eng biikab emet ako igere ile nito ko kit netieme missing President William Ruto koker kole kaisulda komie kobaten yeker kasuldaenyin ko imuch komaisulda komie amu mengen biik amu naet nemotindoi biik ako mi tebutik kole kolya machul NHIF asikoibu shift anan kong'et tuguk chemito shift chekikere kole kororon koibu ako koyomyo eng komosta nebo NHIF. Maybe ninyi tos ikerto ano all this situation nebo shift?
Mongen ala mucha wala kuwele damun it's not my area and then ang na lagi ko pun a lot of consultations, discussions. So I can only read amuche agerite amune sikimoe ke transition. Kimi tuguk chekimoboisie komie, you know, and NHIF. But sometimes ke rebranden kit ko konu, you know, some motivation akoborchi biik kole onge kit komie. So but you know, sait age ko en kong'ung is melelen kot mochamdosi en kot ko ondewendi kot age komokele, you know, welelokse. So but kibwote kele with this transition we hope for the best. Ingele kigerunen amune siki transition. Kot koityi iman biik konyor the care about cancer care. You know, angalolen cancer ndamun it's one of the ibe a lot of funding, even with this open heart. You know, for a long time goto minege ngalale ngalega prevention ak early diagnosis. So damu mai chepkondok chechang koitine every village, you know, komi ngalega how do you prevent this, you know, kiterto ano mionwogik cheuchu. So more funding needs to go there. In the previous one ko kingalale ngalega bainyoru en cancer kolipanun operation netenyu, ilipanun chemotherapy checheng kole, ilipanun radiotherapy these sessions. No ngengalale na nyi, ngengalale big show ke preventen. That is where we hope we will put the focus on. Age equipping the facilities checho konyor. Koyoma actually kotitindai a very best insurance cover agiwe level agiwe dispensary. Yeah. Menyoru CT scan, menyoru MRI. Magi admitting sawa. So we hope get transition ke equipping also the facilities chemiten. So how much daktari kanan pick to the healthcare professionals kwa egasi nenoto agotoret biik.
Okay. Aya, Daktari Maragi, looking forward, tos igertayano in terms of innovation, chetesetai kukuonia kwa isetab muswoknotetab kasari ni wendi kowale for the better or for the best field noton nebo engsetan and surgery?
In terms of innovations, but negi ngun negi mogiye negi gerle to, you know, the toreti biik. Anga o amangalale bigalab telemedicine, you know, kere bi in different ways, but idea about telemedicine ko imuche, you know, you can actually help people jemi far away, you know. Even those rural facilities, when you think of specialists come a certain level, from level 5, level 6, sometimes level 4 hospitals in Kenya. So how do you connect people in the rural areas? They struggle when you access to these specialists and specialized care, not just the people, but also the care surrounding them in the rural areas. So sometimes, if we to empower the rural areas, there has to be a way of even, you know, this telemedicine. It's not really rocket science. It's actually happening. Okay. We one of the things cancer nanin Rwanda Moet, for example. No, ke invite any specialists all over the world. Maganya nega, maten nega. No, you open it out. Europe, America, India. You know, again alalengele. Key, what is the best way ke to this patient? It's a multidisciplinary team. Nangalolen ago or recommendations. So that's one way. You know, ngalalen, you know, asipo ke karorju mgonjwa kele. This is kaya ngalalen ogi bwate kele. Kotienge tu ke the latest evidence ko boru golenan. And then end legimi chigi muje golen. What is the best way? Aga ngalal, you know, komachi mgonjwa gole. Those mock down. So that is one way. The other way go ke the star ki invest in training. Okay. Ki training these consultants, whether it's physicians or surgeons. So that investment has to continue. Okay. Like I think next year we are working with Stanford University as well, how we can create simulation. You know, how do you use technology to teach, examine these as they train to be the consultants? Because if you train more, they will reach more people. Yeah. So investing in training is one. It's not really. So it's about using technology to train more people and actually to make them competent. Other things go robotics. Yeah. mago yache ngele tindai cancer en oret moet impagenyor mapema ko imuchi boisien this minimal invasive procedures. Basically gelenen me machi iyat ku iyat ngeten mago lazima ni kibare laparoscopy wikitindai anteno mi kibare robotics mo kitindai anteno to mot koit Kenya komi so yote legependi and then finally ko ngalekab kerichek how elegertoi kerichek ko mae targetan gele une DNA nangu we target specifically mage going to kerichek because what is considered normal and the general population magele lazima ko normal age so yache gele customize and on how do we treat you
kobunjini
yes not namuna so tuza sawa tu kidogo chembuja kwa teseta lakini amone cha mamuja ke exhaust ni
okay daktari amache getuktini yoto tetutenyo nebo betutab raini mara ngoliot nengung nebo mwisho gewongoti tetutenyo nebo betutab raini
I think netamacha kongwe ndamun en tetutiani nebo oeng ko kelenji biik oba this wellness check early moto tepte maumivu takoit a point ne mokinyoe nebo somok ko borole onge ketoret bikyok ko ngunon enteno kotumo partneren through this marathon toreti tanga siling 100 ko toreti eleo and sikotoretok show
kongoi missing kimagun gi age tugul ne kararan peleka salamu kotenwek.
Asante.
Noton chitab college ko daktari Dr. Kimutai Sylvester na gumite aginen eng betutab raini eng tetutenyo nebo tililindo wongeten yuton bo ketesiet nebo Kass TV omongu kainetke chechang gotinygei ak field niton bo engset anan surgery ak nebo komonut ne komoi daktari keker kele kakimuch kerutechi ketesiosiek choton chebo konyoiset anan tililindo keker kele kakimuch kechikilgei mara yeiwe eng betutab raini ngo betutab karon yeichikilgei ko mengenchi mara ngo kami korotio nemeche kotou ko yeichikilgei kemuch ketoreten mapema. Kainenyu ko Caroline Kiplagat amagun gei age tugul ne kararan testa iker Kass TV amun kimnotet night.
Hey, Mama Bless. Yaani unachemsha maji na gas ya kuoga?
Maji gani unachemsha? Bable, si nilikwambia nyumba ina shopping. Gas imeisha. Tokens zinapiga makelele kama success card. Na hakuna kitu umefanya. Hivi ndio tutaendelea kuishi?
Kila mtu ananiambiana lakini mambo itakuwa tu fit toisort. Unaweza kuona sawa hapo unitumie?
Sikia sasa. Na vile mambo imechemka kwa hii nyumba, mimi nikutolea wapi na sina? Mimi umenichokesha kwa hii nyumba. Na shinanga tu hivyo kila siku toa. Ndio nimekutumia 100 hapo kwa simu yako ujisaidie nayo.
Asante. Yeah, you wanna dance with me? Terror. You wanna dance?
Nini?
Terror. Nimedaka mamili.
Sasa daka mamili ni nini?
Ukicheza daka mamili unashinda 5000 times ya pesa yako in 20 minutes. Na imagine unacheza na as low as 20, 30, 50. Ukicheza na 2000 utapata hadi 10 million Kenya shillings.
Nenda kwenye paybill 440440 account Daka amount cheza na shilingi 20 hadi shilingi 2000 na ushinde mamilioni. Daka Mita kuwa bingwa.
Fine Touch Africa Limited inakuletea pipes za irrigation na pipes za kusambaza maji zijulikanazo kama Fine Drop HDPE pipes. Fine Touch inatengeneza pipe hizi kwa ubora wa hali ya juu na kuuza kwa bei nafuu. Fine Touch Africa pia wanahusika na pipes za drip irrigation, rain hose, sprinklers na vile pampu za maji. Vifaa vingine vya irrigation kutoka Fine Touch ni kama vile greenhouses, agricultural nets, dam liners, solar pumps, rain guns, planting trays, miongoni mwa vifaa vingine vya kilimo. Kwenye mji wa Nakuru tunapatikana industrial area nyuma ya Gido Plaza. Eldoret tunapatikana Nakuru Road. baada ya daraja la Sosiani. Pia tuko Kitale, Kapsabet, Iten, Bomet, Bungoma, Nyahururu na sehemu zingine nchini. Nairobi tunapatikana eneo la Embakasi, Saku Business Park. Ili kufahamu mengi kuhusu bidhaa za Fine Touch Africa, tembelea duka la Fine Touch Africa lililo karibu nawe au utupigie simu kwa nambari 0724 615 066 au 0700 169 962. Kwenye tovuti unatupata kwenye www.finetouch.co.ke. At Fine Touch, we make it green.
My name is Dr. Stephen Tako. I am a cardiothoracic and vascular surgeon. I specialize in all problems related to blood vessels, veins, arteries, the heart, the lungs, and also the esophagus. Today we're talking about varicose veins. Varicose veins are abnormal dilation of veins of the lower limbs. So that means the veins become abnormally big and causes symptoms which can be pain or swelling or sometimes even difficulty in walking. We need to understand the normal arrangement of how veins are on our lower limbs, our legs. So we have two kinds of veins. We have the deep veins, which are found deep inside the muscle, and we have the superficial veins, which are found just under the skin. So when we talk of varicose veins, these superficial veins, which are just under the skin, become abnormally big. All right? And these superficial veins have communication between them and the deep veins. The deep veins are the most important veins in the legs. The superficial veins are important, but sometimes can cause problems like varicose veins. So it all comes when these veins, these superficial veins, they have little doors. They call them valves. We call them valves. These valves, they open and close. So when these valves are working well, blood flows in one direction and it goes back to the heart. But when you have problems with these valves, blood stays longer in these superficial veins. And when it stays longer, the pressure of blood in the veins become high, and the veins, they start to swell and they start to be painful. Not all varicose veins are the same. In fact, to put it in a layman's term, you can classify them as mild, moderate, and severe. This is all related to how big the veins become and the symptoms that they are causing. Sometimes you have very small varicose veins, very small, that you see some green veins on the skin. Those are small varicose veins. And the other ones are the moderate ones, which become big and they swell and sometimes become painful. Then the big ones, the severe varicose veins, are those that have been going on for many years. They are so big, and you might even think there is an abnormality like worms on the patient's legs, and usually they come with a lot of discomfort, a lot of pain. Sometimes they form ulcers, they form wounds, or if they don't form wounds, there is change of the skin color, becomes black, and then hardens up, become very hard. So not all varicose veins are the same, even though they start by the same process of a weak valve that makes blood to stay longer. And then as time goes on, it progresses. It can start as mild, and over time, 2, 3, 4, 5 years, becomes severe varicose veins. People tend to confuse DVT and varicose veins. Now, remember in the beginning I said we have two major veins on our legs, the deep veins and the superficial veins. The superficial veins is what gives us varicose veins. Now, when we talk of DVT, DVT stands for deep vein thrombosis. In other words, you found a clot in those deep veins in your legs. Now, I also mentioned previously that the superficial veins and the deep veins, there are some communications. So when you have a blood clot, a deep vein thrombosis, it blocks blood from flowing in the deep veins. Now, because you have those connections between the deep veins and the superficial veins, most of the blood that is carried in the deep veins now has to channel themselves into the superficial veins. Because the superficial veins were not made to carry so much blood and pressure, they now become dilated. So DVT is actually a risk factor or one of the causes of varicose veins. Yes. So just to add that, between these deep veins in our legs and the superficial veins, 90% of blood flows in the deep veins, and only about 10% flows in the superficial veins. So symptomatic varicose veins, from the word symptomatic, means symptoms. Something is not right. So symptoms due to varicose veins, there are many, but to name a few, you can have swelling of the limbs. You can have sensation of the limbs, your legs feeling heavy, or you have dull aches, or you can have frank bleeding from those veins. When the varicose veins, those superficial veins, become too large, they can actually burst and bleed a lot. So it can vary. There are so many. It can come with pain, it can come with dull aches, with swelling, sometimes bleeding, forming of wounds, or even if somebody with a varicose vein has a small wound over the varicose vein, it bleeds a lot and takes a long time for it to heal. So those are the symptoms that come with varicose veins. There are some people who have varicose veins without symptoms. They don't have pain, they don't have swelling, it's just there swelling. But now one of the other concern is some people, especially women who like to wear skirts, they might not like the appearance of their legs. So the fact that a person is not comfortable seeing the varicose veins, we can somehow classify it as symptomatic, even though they're not feeling pain. The symptom here is that the person is not feeling good about themselves. It's affecting their self-esteem. So there are many risk factors. But one of the most important risk factor is that it has to deal with professions. So you find people who have, as part of their professions, they have to stand for long hours, like teachers, police officers, even doctors, standing up for long hours, or sitting down for long hours, like clerks, secretaries. All this does not help blood to circulate nicely and stays longer in these superficial veins. So long standing posture or long sitting down posture is a major risk factor. Another risk factor is being a female, being a woman. And one of the issues about being a woman is when women get pregnant, for example, the baby, as the baby grows, the weight of the baby presses on a big vein that is in the abdomen. And that interferes with the way blood flows back to the heart. And that increases pressure in the superficial veins through the connection between the deep veins and the superficial veins. And you would notice that many women, when they get pregnant, they tend to discover that they have veins which are swollen. And most often, women will tell you, I noticed this when I was pregnant. Sometimes it comes during pregnancy, after delivery, everything disappears. Yes, so being a female and pregnancy is a risk factor. And obesity. Obesity is also a risk factor. There are many other causes. Sometimes it could be due to more serious causes like some tumors in the abdomen, which can also give rise to varicose veins. So it is important to understand what is the risk factor for varicose veins, because there will be no need to treat a varicose vein when the problem is a tumor, for example, or if the problem is a DVT. So to come back now to treatment, Again, treatment has to be tailored to the patient and also to the classification of the varicose vein. So not all varicose veins are treated the same. Some varicose veins don't need treatment. Some just need to have observation done, look over time, lifestyle modification. If the person or the patient spends more time sitting down, we can encourage them from time to time, walk about, stretch. If they have a profession where they stand up for long, encourage them to sit down and stretch their legs, lift up their legs. Yes. So depending on the severity of the varicose veins and the symptoms, treatment varies. So one of, as I mentioned, observation, just waiting and watching to see if things get better or get worse. Another very important treatment option is wearing of compression stockings. Now, we need to be clear which kind of compression stockings. There are compression stockings for varicose veins, and there are compression stockings for preventing DVT. So we have to be clear when we are using compression stockings. I've had a few cases where people are using DVT compression stockings to manage varicose veins. It's very uncomfortable, yes. So compression stockings can be used to manage varicose veins. There are some medicines that can be given as well. And these medicines, they can treat early varicose veins. It can help. What these medicines do is they help to reduce the size of the varicose vein. But it doesn't work for all varicose veins. It has to be the small ones, which are very small, the tiny ones. When the veins become very big, those medications will not work. And again, the medicines go together with the compression stockings. Yes. So that's for the mild and the moderate varicose veins. For severe varicose veins, you can have two options. There is an option called endovascular therapy. Now, endo in medicine means inside, and vascular in medicine means vessel. So endovascular therapy means inside the vessel treatment. And this treatment is one of the new forms of treating varicose veins, which means there is a small device like a wire. It is put inside the varicose vein, and then it's connected to a special machine. That machine would cause the vein through that wire that is inside the vein to collapse and seal off. That's the endovascular treatment. There is also another kind of treatment called sclerotherapy. In medicine, sclero means to make something becomes very hard, and therapy is treatment, so hardening therapy. So this sclerotherapy is to treat small varicose veins and moderate varicose veins. It means, how is it done? The doctor would inject a specific medication into the vein through a needle, a small needle. And when the doctor pushes that medicine in the vein, it causes the vein to become hard and to close up. That's sclerotherapy. Then in certain cases where you cannot do sclerotherapy, you cannot do endovascular therapy, and compression stockings and medicines have not helped, then the other option is surgery. And during surgery, what happens is the doctor would make small, very tiny incisions over the vein and remove the vein completely. So it's important to note that when you have varicose veins, because those valves are not working well, there is no way you can fix those valves. And remember, I said 90% of blood goes through the deep veins and only 10% of blood goes through the superficial veins, which become varicose. So even if you remove the vein, or you do sclerotherapy, or you do endovascular therapy, you don't interfere with so much of the blood circulation. But the only thing the doctor needs to be sure of is that you don't have a DVT. Because once you remove the varicose veins, the superficial veins, the patient will rely now on the deep veins. Later on, they will form small superficial veins, but most of the blood flow will go through the deep veins. So varicose veins can be treated. and treatment is available in this country and in this town. The cases I've seen, I've done sclerotherapy for patients, I've done surgery for patients, and so some other special patients, we observe them. But let me talk about the interventions, the sclerotherapy and the surgery that I've done. Sclerotherapy is a day procedure. You come in the morning, the doctor would prepare you for the procedure. It's actually done in the office or even in a bedside situation. Once the vein is injected, we give you a few hours of observation, because sometimes some people might feel a bit of itching because of the medicine. And when everything is okay, we feel you're good to go, we discharge you home. Unfortunately, we don't have the
Hey, Mama Bless. Yaani unachemsha maji na gas ya kuoga?
Maji gani nachemsha? Bable, si nilikwambia nyumba ina shopping. Gas imeisha. Tokens zinapiga makelele kama success card. Na hakuna kitu yote umefanya. Hivi ndio tutaendelea kuishi?
Kila mtu ananiambiana Donald, lakini mambo itakuwa tu fiti toisot. Unaweza kuona sawa hapo unitumie?
Sikia sasa. Na vile mambo imechemka kwa hii nyumba, mimi nikutolea wapi na sina? Mimi umenichokesha kwa hii nyumba. Na shinanga tu hivyo kila siku toa. Ndio nimekutumia 100 hapo kwa simu yako ujisaidie nayo.
Asante. Yeah, you wanna dance with me? Terere, you wanna dance?
Nini?
Terere, nimedaka mamili.
Sasa daka mamili ni nini?
Ukicheza daka mamili, unashinda 5,000 times ya pesa yako in 20 minutes. Na imagine unacheza na as low as 20, 30, 50. Ukicheza na 2,000 utapata hadi 10 million Kenya shillings.
Nenda kwenye paybill 440440 account Dakar amount, cheza na shilingi 20 hadi shilingi 2,000 na ushinde mamilioni. Dakar Mita, kuwa bingwa.
Tetat KI edition nebo kenyini nebo labatet nebo Nairobi City Marathon eng tarikit 8 arawetab 9 kenyit nebo 2024 eng taonit nebo Nairobi. Labatani nebo Nairobi City Marathon kotetat korwairwoi kobun barabaret nebo Expressway. Tesetai nguni siretab K nebo labatani eng categories cheterter. Eng category nebo 42 kilometers kesirengei 1,100 ak 500 eng 21 kilometers kesirengei 1,100 ak 200 eng labatet nebo 10 kilometers kesirengei 1,100 ak eng labatet nebo 6 kilometers kesirengei 500. Asisirchigei labatani irutechini website nebo Nairobi City Marathon nebo www.nairobicitymarathon.com. Nyon labat ak iboiboenji lelesta nebo barabaret nebo Expressway koboto barabarosiek chebo taonit nebo Nairobi eng betunoton.
Hey, Mama Bless. Yaani unachemsha maji na gas ya kuoga?
Maji gani nachemsha? Bable, si nilikwambia nyumba ina shopping. Gas imeisha. Tokens zinapiga makelele kama success card. Na hakuna kitu yote umefanya. Hivi ndio tutaendelea kuishi?
Kila mtu ananiambiana Donald, lakini mambo itakuwa tu fiti toisot. Unaweza kuona sawa hapo unitumie?
Sikia sasa. Na vile mambo imechemka kwa hii nyumba, mimi nikutolea wapi na sina? Mimi umenichokesha kwa hii nyumba. Na shinanga tu hivyo kila siku toa. Ndio nimekutumia 100 hapo kwa simu yako ujisaidie nayo.
Asante. Yeah, you wanna dance with me? Terere, you wanna dance?
Nini?
Terere, nimedaka mamili.
Sasa daka mamili ni nini?
Ukicheza daka mamili, unashinda 5,000 times ya pesa yako in 20 minutes. Na imagine unacheza na as low as 20, 30, 50. Ukicheza na 2,000 utapata hadi 10 million Kenya shillings.
Nenda kwenye paybill 440440 account
Kass
amount, cheza na shilingi 20 hadi shilingi 2,000 na ushinde mamilioni. Dakar Mita, kuwa bingwa.
KC
KCB Mobile Loan ni mkopo flexible kabisa na kwa viwango nafuu. Pata mkopo hadi milioni 1 kwa kiwango cha 1.2%, ulipe ndani ya siku 1, siku 7, siku 14, siku 30 au mkopo wa muda mrefu hadi mwaka 1 kwa viwango nafuu. Kupata KCB Mobile Loan bonyeza *522# au tumia KCB app leo. KCB, for people, for better. Sheria na masharti kutumika. Inadhibitiwa na Benki Kuu ya Kenya.
Geto a new irrigation dam to gomda kesochin kule kisoe kele torrot kone mwag kisop chabich kisop sabon ko golbi kole nyanyin ibwat kisir sauti nono en bogot kotom kotogo boy Kenya chumbek ne likurech kostoikyo mogie siasa akwanet rambe nebo tesetab tai nigie kine practical nitogu ak ne goro gutiet kemwa harambe kityo asikobit ketestai kwanet amangolo kosan tugul en conference kwanet harambe 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 kwanet harambe nebo harambe Kongo misi kitab kwalen kitab kwalen kumwe wanyila mwana kiye gure nyasangwa kono liteti kimache gastugul ngole chega tul gondo ndo harambe ke renji irrigation tatu ko chit metit Kongo kasarikyo kirikyo kache karita chaga ngogen engetse jana Kass FM International in Textiga Washington DC go tugul ko guna tawigit kimi soet kwanet No, Kansas, Kutsapa, Kansas, Cass County's Forum, Kansas, the Parisian Kenyan International in Washington, D.C. Ache, kini nila kwanet, Kansas, kula lagere chapati ni chegat, keto stack mtiet kogo tugul, rauni tarigit sumagenge in Rob Tui. Kabe gunota ni Rob Tui, sigebe kuret. Tuyen Kalenjin ko August wen rubu nebo sogol kekuren kuret so koleron kasit. Muret ko kalenjin chebo keny kokile winter. So arawetab winter, arawetab kochichit ak anyun kinwe kukungwera ne korotui kokoni muret. So ongibwat kele koron ko muret kasit en